NACCHO took a leadership role in working with the Human Rights Equal Opportunity Commissioner and Oxfam. We sort of worked together with that and approached the federal government in regards to closing the gap. We did a summit and we signed off a statement of intent with the Prime Minister and all his ministers and also the opposition leader. We believe that with what they're saying, they need to put an implementation process towards it and make sure they just don't talk about it, make sure that they start to do something. And NACCHO itself are very willing and have put up our hand to work with the government on trying to close the gap as much as possibly can. We play a very important role. We have over 140 members, and through our organisation, the medical services, we have a lot of contact and do a lot of episodes in medical treatment. Plus there is a lot of episode of primary healthcare processes, so we play an important role in bridging that gap. A lot of our people come to us to seek their medical treatment and advice, so we are fully aware of a lot of the risk factors, plus also the environmental factors that we could help our people with. I think we could advise the government, but we could also take a leading role in directing government through our working together as a partner. We have, through the boards and through the community engagement, we have a lot of expertise there. So I think if the government would work with us, provide us the right resources, we could be more pretty valuable to the government. Yeah, we've been flagging the workforce issues for a long time. It's all right to get the numbers there, but we need the proper salary packages and resources, plus housing to ensure that we've got the right people in there. If you have a look at the intervention in the Northern Territory, government were able to get housing and for doctors and the teams that went up there. Aboriginal people have been calling for houses for a long, long time to improve their environment, but nothing's been forthcoming. Well, health is not all about clinical treatment. It's about all the other underlying factors. If you don't have good education or good housing, employment, you don't have good health. So there's nothing to really strive for. We really need to look at a holistic process like that's how NACCHO really defines health in a holistic way. I think each individual themselves, whether Aboriginal or not, need to take responsibilities, but at saying that at the same time with Aboriginal people, if we haven't got the resources to move ourselves forward, I mean, it's all right to say that, we're doing all this stuff for Aboriginal health, even with the intervention in Northern Territory, he knows straight, they've done a lot of good child health care up there, but then if you're going back to the same old environment where it happens and not changing that, then we're not going to get anywhere. Even just to bring Aboriginal health up to scratch, I mean, we've been calling for 460 million for a number of time, and that's really just getting us back equally as everybody else. And I think once we start to be on the same level, then we could start to move forward. But I think resources, proper commitment from government, but not only commitment but doing as well. They need to implement things and work with particularly our sector, the community control sector, to ensure that we're moving together and trying to address the Aboriginal health problem. Yeah, I think all of government, whether we start from the local government or even community government on a Aboriginal community, they all need to have the same goal. I mean, there's too much confusion sometimes, and they say with community control health, there's a duplication of the state health. If they looked at, I believe, looking at the primary health care within Aboriginal health and fund that separately to hospital and health service programs that government run, then it'll be a lot easier. The money will go further, I think.